I kind of want to pursue photography, maybe not in a professional extent, but like a little bit more than a hobby.
With the 18-week ultrasound, we were just trying to find out if he was going to be a boy or a girl. And then the technician kind of saw some signs of issues with the heart.
He was 10 days old when he had the first surgery, and then they actually had to go back in less than 24 hours later and do another one. The whole first year was going home for 3 days, going back for a week, going home for a week, going back for 2 days. Any little thing would cause us to need to go because his oxygen levels weren't high enough.
The focus when we have a sick child is family-centered and patient-centered care. There's an enormous amount of support that we have to give these families when they first present to us and babies are born, and then through the perioperative period, and then after surgery as well.
Dr. Raff did all his surgeries. I don't know when he slept. I don't think he did. I still don't know if he does.
He really helped us with what we were going through as new parents. It seemed like he was there only for Casey, and that was really honestly something that really touched us, and that's why we consider him a superhero. No, we've had perfect care.
It's really hard, I think, to be in their shoes, but we have to do the best we can. You know, the kind of care we want to provide to the children we care for is the care we want for our kids.
The time just went by so fast. He's 16 now. I don't think about the pain and the suffering that we went through, but we just look at the good times.
90% of people would never know by looking at him what he's been through or what he still has to go through.
I don't really think I have technical limitations, really. I just have a condition that kind of makes me a little bit worse at physical activity. I'm kind of just a little bit under, but I can still rise above.